consume more fruits and vegetables and not so much of the fast food, processed foods, and even yung mga soda, ganyan.
Mm-mm.
Still water therapy. Probably they can consume it but in moderation. Hindi
Mhm.
mo siya araw-arawin.
Hindi araw-arawin.
Mm.
Kasi sabi nila, maski araw-araw, basta konti, pwede daw.
Basta pag
Basta konti, oo. Pero everyday naman. So,
Oo nga
yeah.
eh.
So,
Konti pero minu-minuto.
tatanong ko din, sino yung mga most at risk para magkaroon ng ganitong klaseng disease na colorectal, aside from the ones who have it in their history, kunyari sa family,
Mhm.
gano'n.
Well, age is also a risk factor, no?
Mm.
So that's why there's a particular age where you get to have to recommend screening, and then others is it's really more on lifestyle, no?
Mhm.
Yung diet talaga. Well, sometimes people who yung mga jobs na especially seaman, yung mga ganon.
Oh.
Kasi mostly yan mga processed because they live in the ship
Oo,
for
oo.
quite a long
Yes.
time.
Oo,
Taon,
hindi
diba?
fresh yung
Oo.
kanilang
Hindi
kinakain.
organic.
Oo.
So, there's no study yet, but it can be a risk factor.
Mhm.
So, it boils down more po sa pagkain,
Mhm.
tsaka sa lifestyle.
Oo.
Inom ng
Food
alak,
intake, oo.
smoking. So, those are no-nos in
Mm-mm.
terms of cancer.
Mm. At nabanggit mo nga kanina, kapag dumating yung mga simptomas, malala na yung cancer.
Mhm.
Oo, anong stage na usually yun kapag ganyan na yung pupo mo, iba na, galapis na o kambing na?
Well, usually, ma'am, nasa advanced na. There are only
Mm-mm.
4 stages of cancer. So,
Mm-mm.
stage 1 to 4. The staging would depend on laki ng bukol, presence ng kulani, at kalat sa ibang organs.
Mhm.
So, mostly for patients na may obstructive symptoms, yung talagang nag-weight loss na, or nag-iiba na yung pagdumi, yung itsura or character ng pagdumi nila. Some are mostly advanced stages. Nasa stage 3 or stage 4 na sila.
Mhm.
Pero
Oo.
hindi nila alam yun because they don't feel anything.
Yeah,
Wala bang
those
pananakit
don't-
ng tiyan? Ganon?
It's not specific for each patient. Parang
Oo.
iba-ibang experience per patient.
Mhm.
But that can also happen, no? Abdominal pain, pananakit ng tiyan, posible siya. Or bloatedness, kabag, possible din. Changes in bowel movement, parang
Mhm.
alternating na diarrhea and constipation
Mhm.
can happen.
Lahat na lang.
Yeah,
Mm-mm.
it's non-specific.
Oo.
Okay. Pero kapag ganito na, yung nga medyo late na nakita ang colon cancer, may treatment pa ba para ma-prevent ang spread pa ng
Can one
cancer?
survive?
Oo.
Yeah.
Yes, oo.
The treatment for cancer is upfront surgery kung kayang maoperahan. Like in any form of cancer, you want to remove the primary tumor or bukol. And then, pero sometimes when it's stage 4 already, may role pa naman ng surgery to try to minimize yung burden of cancer in the body. But we usually recommend also giving chemotherapy.
Mhm.
No, nakikimo na, or even radiation therapy kung kinakailangan.
Okay. Yung sabi mong surgery, Doc, pinuputol yung bituka?
Yeah.
Mm-mm.
The goal of surgery for any form of cancer, you remove everything.
Mm-mm.
No?
Everything,
Even the, kung nasan yung bukol, I mean,
Okay.
even the lymph nodes. Kasi lymph nodes
Mga
or
kulani,
those
oo.
are routes for metastasis.
Mhm.
Kaya sila kumakalat sa ibang organs. So they also harvest those, especially if, yun nga, kung papasok sila at mag-oopera, tinatanggal lahat.
Mm-mm. Pero it doesn't mean that yung lymph nodes would transform into parang bukol-bukol. Hindi naman.
We test it also sa histopath. We check if may mag-positive na cancer doon.
Mm-mm.
So sometimes they report it as kunwari 12 yung hinarvest. Mostly 12 ang required actually if it's
Na
colon.
tinatanggal. Oo.
Yes. So they tested 6 out of 12 lymph nodes are positive, yung ganon. So we only see that through histopathology sa
Histopathology.
laboratory siya.
Okay. May iba po na kapag tinanggal yung bahagi nung kanilang bituka, ay nilalagyan sila ng colostomy bag
Yeah.
para doon nalalabas ang dumi. So, wala bang pag-asa na, kumbaga, pagtugtungin na lang yung bituka para hindi na magko-colostomy bag? Lahat ba ng colon cancer patients, they have to have this colostomy bag?
Well, mostly, especially for low rectal, na depende actually siya dun sa location of the tumor. Sometimes for right-sided, ang bituka kasi, ang malaking bituka or large intestine, it's very long. You have the ascending, the transverse, and descending colon. And you also have the rectum, kung nasan malapit tayo napupupo. No?
Mhm.
Especially for low rectal, low na colon cancers, they require having the colostomy.
Mm.
And sometimes yun yung medyo debilitating for patients.
Oo.
It's because it's going to be permanent. But for some na right-sided, hindi siya kinakailangan or even transfers. It will really depend on the location of the cancer.
Oo. Depende pala yun.
Yeah,
Oo.
not
Hindi
all.
naman lahat eh.
Yes.
Yung nga ang kinakatakot ng ilan, na baka
Mm.
mamaya daw, syempre ang hirap ng meron kang bag ng dumi
Yes. Oo.
na dala-dala mo
Tapos
everyday, di
nakikita
ba?
mo siya
Oo.
na lumalabas.
Okay. Anyway, ito si Hilda
Parang
Antarip.
natatakot ako magtanong.
Bakit?
Sige, basahin na lang natin yung mga sa ating listeners.
Oo nga ba,
Let's
kaya
ask
ka
Doc.
pala ninenervyos dyan. Si Hilda
Ah.
Antarip ng Dasma Village, Dok, gumagaling pa ba pag stage 3 na yung colon cancer? Or hindi ba kapag nag-chemo, parang wala nang chance mabuhay? Ganun ba ibig sabihin nun?
Well, for stage 1 to 3, at least the intent is curative. So you want, gusto